Welcome to The Explainer. Today, we're diving into one of the most significant, life-limiting challenges for people living with ALS, breathing. We're going to break down the absolutely critical role of the specialists who help manage this journey.
So, I want to start with a number that really frames everything we're about to talk about, 80 to 95%.
And what does that number mean? Well, that's the percentage of people with ALS who will eventually have to deal with respiratory insufficiency, a profound difficulty with the simple act of breathing. This is exactly why understanding respiratory care isn't just a part of the story of ALS. For so many, it is the story.
Okay, so here's our game plan for this explainer. We'll kick things off with the core challenge itself. Then we'll introduce you to the expert who guides patients through it. We'll walk through their stage-by-stage plan, see the whole team they work with, and wrap up with the ultimate goal of it all, breathing with dignity.
All right, first up, let's really get a handle on the core challenge here. ALS, or amyotrophic lateral sclerosis, is a progressive disease, which means it weakens muscles all throughout the body. And this includes the most essential muscles we have, the ones we count on for every single breath, like our diaphragm.
So, as these muscles get weaker, it leads to what doctors call respiratory insufficiency. And in simple terms, that just means the lungs can't do their main job of swapping oxygen and carbon dioxide the way they're supposed to. This creates this ripple effect of profound fatigue, shortness of breath, and a really serious risk of infections like pneumonia, which can be just devastating.
So who steps in to manage such a complex and critical problem? Well, that brings us to the hero of our story today, the respiratory therapist, or RT for short. And you've got to understand, there's so much more than just clinicians. They are expert guides for patients and their families on what is an incredibly difficult journey.
And their role is incredibly comprehensive. It goes way beyond just managing machines. We're talking about RTs working to optimize breathing, tailoring every single intervention to the specific stage of the disease, and, this is huge, aligning all of that care with a patient's personal goals. Whether that's prolonging life or really prioritizing comfort. They're also teachers, training caregivers and providing just vital emotional support.
And all this expertise builds into a really proactive plan. You see, respiratory therapists don't just react to problems as they pop up, they use precise data to monitor how the disease is progressing so they can step in before a crisis hits.
One of their key metrics is something called forced vital capacity, or FVC. The easiest way to think about it is to imagine emptying a balloon in one big, powerful puff. That's kind of what it is, a measure of your total lung capacity. When that number drops below 50% of what's expected for a patient, it's a critical signal. It tells the RT it's time to start introducing some breathing support. But it's not just about lung capacity. They also have to measure pure strength. That's where MIP and MEP come in. MIP basically checks the power of an inhale, while MEP measures the exhale. This tells the RT exactly how much those breathing muscles have weakened, getting right to the root of the problem in ALS.
And finally, they measure something called peak cough flow. A strong cough is our body's natural defense mechanism for clearing out our airways. When that cough gets weak, the risk of a dangerous infection just skyrockets. This measurement tells the RT exactly when a patient needs help clearing secretions to stay healthy.
So you take all this data, the FVC, the muscle strength, the cough power, and it all comes together to form a clear, strategic plan. Early on, the focus is all about education and techniques to keep the lungs working well. As the disease progresses, they bring in crucial support like non-invasive ventilation. And then, in the late stage, the plan adapts again, either managing more intensive ventilation or shifting the focus entirely to comfort.
And non-intervention from the middle stage, non-invasive ventilation, or NIV, is a total game changer. It is considered an absolute cornerstone of ALS care. And the reason is simple. It doesn't just improve survival by a really significant 7 to 12 months, it also dramatically improves a person's quality of life along the way.
This brings us to the two main roads for ventilation support. On one side, you have NIV, which uses a mask to deliver pressurized air. It's the standard of care, widely adopted. On the other side is invasive ventilation, which requires a surgery for a tracheostomy. Now, this is a life-sustaining choice, but it's one made by a smaller group of patients, and it involves some really intensive training for caregivers. Now, to manage all these interventions, RTs are masters of a pretty specialized toolkit. We're talking NIV devices, often called BiPAPs, mechanical cough assist machines, suction devices to keep airways clear, and even home monitoring tools that empower caregivers to keep a close eye on vital signs. But here's the thing.
And RT never works in a vacuum. Successful ALS management is truly a team sport. Collaboration is absolutely key.
The RT is a vital piece of a much larger puzzle, this multidisciplinary team. They are constantly collaborating with neurologists, physical and occupational therapists, speech pathologists, dietitians, social workers, you name it. And this integrated approach, where every single specialist brings their expertise to the table, is proven to lead to better outcomes for patients. It just works.
And you know, perhaps one of their most important collaborations is with the people on the true front line, the caregivers. RTs provide extensive, ongoing training to family members, empowering them to manage the daily equipment, to handle emergencies, and to recognize the signs of respiratory distress with confidence.
All of this, the data, the technology, the teamwork, it all leads us to our final and, I think, most important section. Because the ultimate goal of all this highly technical, complex work is something deeply human: breathing with dignity. This really highlights how the entire focus of care evolves over time. In the late stages of ALS, the main goals actually shift away from aggressively correcting lab numbers, like CO2 levels, and move toward prioritizing symptom control and maximizing quality of life.
So what this means is that the care plan is still very active, but the goals have adapted. In palliative care, the RT uses all of their expertise to ensure physical comfort, to help manage that feeling of breathlessness, and above all, to make sure the care being provided truly honors the patient's personal end-of-life wishes. The expertise and the technology, it's all there, but it's delivered by dedicated, hardworking people. It leaves us with a really vital question to think about. How can we, as a society, better support the clinical teams and the family caregivers who are on the front lines, helping patients with ALS breathe with dignity every single day?